Thank you for joining us today to learn more about the meaningful work underway through the Vocational Rehabilitation Technical Assistance Center on Program Evaluation and Quality Assurance, also referred to as PEQA. PEQA is funded by the Rehabilitation Services Administration through a cooperative agreement. The project is really designed as an investment to build capacity within state vocational rehabilitation agencies to enhance program evaluation and quality assurance capabilities at the state level. My name is Kate Anderson, and I serve as the PI and Project Director of PEQA. I'm employed through the University of Wisconsin-Madison, and we work in close partnership with the Stout Vocational Rehabilitation Institute and other partners. My colleagues are also going to introduce themselves at this time.
Hello, my name is Seung P. I'm a research associate at Michigan State University.
Hello, this is Timothy Tanzi. I'm a professor at the University of Wisconsin-Madison in the Department of Rehabilitation Psychology and Special Education, and I'm a co-principal investigator of the PEQA project.
Hi, Terry Donovan with the Stout Voc Rehab Institute, and I work with the course and supporting participants in the course.
Thank you. Again, PEQA is funded by the U.S. Department of Education, Rehabilitation Services Administration, and the key partners involved in designing and implementing PEQA are the University of Wisconsin Stout Vocational Rehabilitation Institute, the University of Wisconsin-Madison, Michigan State University, the Council of State Administrators of Vocational Rehabilitation, and the Summit Group. PEQA involves multiple components, specifically an online certificate program and capstone projects, as well as advanced workshops, community of practice that is coordinated through the Summit Group, although there are multiple smaller time-limited communities of practice available through PEQA as well. And throughout all elements, the partners actively collaborate to ensure consistency and open communication across partners and certainly in close collaboration with the state agencies and Department of Ed. We currently have 7 cohorts, and new cohorts were actively recruited and accepted every 6 months throughout the program, beginning fall 2016 and ending with a winter 2020 cohort. Cohorts are comprised of both individuals from state VR agencies as well as small teams of up to 3 individuals from a state agency that commit to working together to progress through the online coursework, as well as design and implement a capstone project. All of the coursework is available online and is designed to be flexible in meeting participant needs. The majority of it is available asynchronously, which means that participants can work through at a time that is the most convenient for them. And certainly the advanced workshop series have been expanded to offer more flexibility for participants to engage as well. There are a total of 37 of the 78 state vocational rehabilitation programs have been accepted to participate in PEQA. We currently have 29 state agencies participating, which includes 13 combined state agencies, 7 blind agencies, and 9 general state VR agencies. The PEQA learning goals. Course content is designed to enhance the knowledge and skills necessary for evaluation programs, policies, processes, and/or people. By participating in PEQA, participants gain the following skills: understanding the principles of evaluation, selecting appropriate research methods, designing, implementing projects within their state agencies, analyzing the findings, and then preparing reports for multiple stakeholder audiences. All of the coursework and the resources and content have been intentionally aligned with the American Evaluation Association's evaluator competencies, which were originally developed in 2015 and again further revised and ratified in 2018. The PEQA online course domains involve 6 primary domains. Domain 1 provides an overview of evaluation, leading into Domain 2, which covers research methods. Domain 3 involves data collection, strategies, and techniques. Domain 4 provides an overview of data analysis, including strategies and techniques. Domain 5 covers applying findings and reporting across multiple stakeholder audiences. And Domain 6 serves as a repository of research and resources, essentially an online library that participants are welcome to access and share information with others on their teams in support of building a culture around program evaluation within the state VR agencies.
PEQA is a cooperative learning model. As you can see, it's a student-centered approach using instructional methods, particularly around group members helping each other and different collaborative activities. When the course started, we based it on a University of Wisconsin Stout graduate certificate in program evaluation. Over the years of the project, we've made a number of modifications based on our group learning activities, what members told us was most applicable to them in vocational rehabilitation, what types of items could work. So we've made a number of different modifications to the different domains that Kate identified as we've evolved this particular course. And one of the pieces we made a change to, the Capstone Project used to be at the end of the project. People would do coursework and then complete it. We now integrate the capstone right in the beginning of the project, which we find has increased learning and has increased the content and quality of our capstone projects. So as you can see, some of the course modifications that we have made over time, Domain 1 overview, Domain 2 having to do with research methods, but this is where the Capstone Project begins. We found this was probably one of our most significant modifications. Originally, individuals would complete all 6 domains of the coursework, and then they would start their Capstone Project. By integrating the Capstone Project, we were able actually to eliminate duplication in coursework. In Domain 3, one of the other pieces, as you look at Domains 3, 4, and 5, we began to realize that many of our students had competencies in some of the areas within the coursework. So we've adjusted to letting individuals select those that they wanted to learn more about or content areas they were unfamiliar with that could supplement what they already know. So as you can see, the data collection, they complete 1 of 3 modules. Analysis, 1 of 4. Domain 5, we have required assignments. And then Domain 6, which became primarily a research and resources content item for students. We have found, based on our ongoing conversations with our students, that they have found our modifications over time to be especially helpful in terms of their learning and their ability to complete within the amount of time allowed.
The Capstone Project is a multifaceted training component. It serves as a culminating experience to synthesize knowledge and skills acquired through PEQA, which means it is designed to help a program evaluation specialist at the state VR agency to apply their learning to their real work settings. This slide shows the overall capstone procedure. Even though each participant can begin their capstone project at a certain time, we also ask them to think about their capstone project from the beginning when they prepare for their capstone application. In that phase, most applicants can consult with their supervisor or state administrator to identify their program evaluation needs or the priority for their state. The second phase, we survey their topic inventory. So briefly, they can participate in a survey. So just tell us about their interest about the Capstone Project. And the Michigan State University Capstone team usually have the informer, the interview with the participant, or sometimes with the team. Sometimes they brought really big topics which can cover about like a year or more than a year. So then we usually help them to refine it so they can actually finish it in a certain time frame. After that interview, each participant can develop a research plan, and based on the research interest and expertise, we assign a capstone mentor to each participant or team. After they develop the capstone proposal, each participant and the team can implement the project, and also they can collect the data and also report the progress with the faculty mentor. Phase 5 included the draft and the final paper, and then next they can present their study and their project too at the CSADR or the summit conference. So this slide shows the current capstone status. A total of 35 participants or teams completed the topic inventory survey, and also they did the initial interview with the capstone team. As of April 30th, 2020, 8 completed the Capstone Project, 4 were withdrawn from the program. Most of them because of the relocation or some personal issues. 12 mentors have assisted the participants with their Capstone Project, and 23 are actively and currently engaged in the Capstone Project. You may be curious about their topic. I can say they are really diverse because each state has different needs, different priorities, and also each participant have different level of knowledge and skills. So I just listed common topics. Most of them is based on the WIOA implementation. So one of the most common topics include program evaluation of existing programs, such as existing pre-app programs or summer student programs. The other common topic includes the development or validation of quality assurance material, such as a case review tool or the performance measure indicator. Some topics include issues related to the PR process or outcomes. This is very similar to the previous outcome study. So, for example, a participant investigated the effectiveness of college services, and the other person looked at the effectiveness of the services for the customers with mental illness. So as you can see, these are our Capstone mentor team. So we started from 5 mentors at the beginning, but we expanded the list of the team, and then so we can help more people. So as you can see, people from the University of Wisconsin and Madison. Also 2 people are from Mathematica, and 1 person from the University of Buffalo, and the other 5 people are affiliated with Michigan State University. You will find more details about the Capstone Project at our website. So you can see in the PEQA website, we have specifically located them into the Capstone Project Hub. We had great feedback about the Capstone experiences, as well as the online coursework. So first person, Deborah said from Virginia, she thought it is an excellent opportunity for the professional development, and also she said it provided information and relevant issues or the resources to share with the colleagues at the state VR agency she worked. Jacob from South Carolina General Agency, he thought throughout the Capstone and then with the PEQA project, he actually obtained in greater skills and proficiency in his work.
In addition to participant reflections, we've heard positive feedback from vocational rehabilitation agency directors as well. Specifically, Allison Flanagan, who serves as the director for the Florida General Agency and also now serves in a leadership role within CSAVR, shared her reflections in that program evaluation and quality assurance strategies are invaluable because they identify best practices that can be replicated throughout the organization, as well as identify opportunities for improvement. Monitoring performance data and casework helps us, their agency, pinpoint causes of systemic problems and processes that may be outdated or ineffective and ensures compliance with state and federal regulations. Furthermore, success of VR initiatives is dependent on proactive and effective program evaluation, which ultimately supports the successful employment of individuals with disabilities. And we've heard similar comments from other VR directors, both in terms of the importance of building the capacity for strong internal program evaluation and quality assurance within their programs, as well as the benefit that they felt that they've received by having their staff participate in the PEQA program, both to build that capacity in terms of knowledge and skills, as well as connect more broadly with others employed in similar roles across state VR agencies.
The PEQA project has offered 13 advanced workshops to state vocational rehabilitation counselors across the country. These workshops were intended to address areas of in-service training needs that were identified by administrators of state vocational rehabilitation programs via a needs assessment conducted in the first year of the project. The advanced workshops were initially designed as in-person, hands-on workshops to advance evaluation skill and capacity, but expanded to include online training. In partnership with collaborators, the project provided training on topics including how to use R, an open source statistical software program for program evaluation and for RSA 911 data mining, integration of WIOA performance management and performance measures into program evaluation, identifying and overcoming barriers to program evaluation and quality assurance, providing the online program evaluation coach, strategies for conducting customer satisfaction surveys, and how to use Excel pivot tables as a low-cost method of program evaluation. Over the course of the project, we have observed substantial growth in the number of attendees in the advanced workshops. We have shifted from providing primarily in-person trainings at the Summit Conference to an online model to increase the accessibility of the training to state vocational rehabilitation program evaluation personnel. Beginning with a modest 35 participants at our first in-person workshop in year one of the project, the number of participants grew to 712 participants in year 4 of the project. Across the entire project to date, we have provided training to over 1,300 participants through the Advanced Workshop Series.
The Summit Group is an organic community of practice that was originated to focus on building performance management and vocational rehabilitation. It was started as a partnership between state vocational rehabilitation personnel with leadership provided by Kyle Walker and members of his team at the Utah agency at the time, in partnership with university professionals, with a common interest, again, of building capacity and engaging in discussion and dialogue around program evaluation and quality assurance issues within state vocational rehabilitation agencies and providing support for each other in advancing this area. Communities of practice, quote by Etienne Wenger, who was really kind of the originator of communities of practice, describes them as groups of people who share a concern or a passion for something they do and learn how to do it better as they interact with each other. So really, again, organically building the capacity together over time. The Summit Group forms networks to connect program evaluation and quality assurance specialists who oftentimes can be siloed within their agencies, and siloed just meaning that many agencies may employ one individual or two individuals in these roles, and so it provides a broader opportunity to connect with others in similar roles. The network also enhances the professional development of VR PEQA specialists, and certainly in partnership with the grant-funded PEQA project, we've been able to help advance those efforts. It also is designed to foster continuous improvement through sharing of tools, resources, and promising practices, and facilitate innovation through group problem solving, ultimately leading to contributions in the professionalization of PEQA specialists. The Summit Group does have a website, and for the time being, you can find it through the PEQA website, but it is also designed to be a standalone site. The Summit Group has held conferences for 12 years. This year is designed to be the 13th summit. However, due to other environmental considerations, it's being moved to an online event this fall 2020. PEQA and Summit have partnered on 4 conferences to date, specifically the 2017 conference, which was held in Omaha, Nebraska, 2018, which was held in Oklahoma City, Oklahoma, 2019, which was held in Portland, Maine, and to date had the highest registration and participation rate yet, with 189 participants on site. And the conference 2020, again, will be moved to an online event this fall, and more information will be available very soon. In terms of the overall implications for service and policy related to program evaluation and quality assurance, what we've learned through the PEQA project is that the Workforce Innovation and Opportunity Act certainly emphasizes performance accountability measures for the vocational rehabilitation programs, which provides opportunity for ongoing partnership and also to help support the ongoing training needs that exist for state VR staff who may be either new to their program evaluation and quality assurance roles, as well as those who have already been working in their roles and or in more sophisticated systems over time. We now recognize that there is certainly a continuum of training needs and continuum of support needs, and having the opportunity for individuals to go through a program that's designed and aligned with established competencies, but delivered in a flexible format to meet the realistic workload demands within their state agencies seems to work well. Additionally, continuous collaboration is needed between administrators, policymakers, VR staff, practitioners, and educators. Really, it's not just the program evaluator that can do it all, but really it takes collaboration and an ongoing effort and commitment across partners for effective program evaluation and quality assurance to help change the culture within the agency, leading to improved data and ultimately improved outcomes and impact within the programs. The PEQA materials can be found on our PEQA project website at pequatac.org. Again, the capstone information that Dr. Supi had mentioned earlier is also available. And as capstones are completed, we are actively moving the content over to the Capstone Hub, so you will see that continue to grow in the coming months. And again, you're welcome to take any of the materials, use them within your state agency, and or share them with others. Thank you for taking the time to learn more about PEQA today. Our contact information is available through the PEQA website, and you are welcome to contact us with any questions. Thank you.